Since the holidays, we have seen a significant increase in the number of COVID cases here in the North Country and in your home county, Warren County. Is the state of New York and the governor taking the appropriate steps that they need to right now to deal with this surge that we're seeing?
You know, we are seeing a surge that was predicted. You know, I mean, and now we're all armchair virologists. You know, but you know, they said that over time, as the virus mutated, it would become more contagious and less deadly. And I think we're starting to see that. Now, it's not to say that people aren't still getting it and they're not still dying from it, and it's certainly not to say that it's still not a public health crisis. But you know, it's playing out the way that we thought that it would, the numbers game would. You know, and the idea of you know, that you know, we're surprised that we are in a mess that we're in the winter months. You know, with this surge. The surge is starting to crest right now. I mean, I think the role of government here should be to make everything as available, including information, as possible. So whether that's PPE or testing equipment or vaccines, make it readily available, get it out there, distribute it efficiently. You know, I won't fault the state government in the testing kits, but nationally, somehow we find ourselves behind the 8 ball where we don't have enough testing kits. I mean, there's no excuse for that. We should have had this is 2 years that we're into this now. That shouldn't be an issue, but make it available, educate people where it is, educate people on the risks and the value of the shots, and then follow science. And if that science means that we don't need to quarantine, we don't need to shut down. I mean, you're saying follow the science, and on Saturday afternoon you're watching a football stadium with 70,000 people and no one wearing a mask. And then we're not letting anyone into the legislative office building in Albany to go talk to their legislators about how to put together a $212 billion. It's hypocritical. It's not consistent. So, you know, I think that we need to unify a message, and we need to be realistic in that message. And again, I'm a big believer in benchmarking. You know, I mean, you know, we're not in this alone. What's Vermont doing? And what are their numbers doing? What's Florida doing? And what are their numbers doing? And when you start to look at that, there are other states that are not, you know, as throttled down as we are in New York, who have better numbers. So I think we can be learning more from surrounding states. But I think that unfortunately both sides are trying to use the virus for political advantage. And now we're in the midterms. You know, so I mean, that's telling me really we got 11 more months of this because we want to make sure that we get every drop of political value out of the virus. You know, I'm beyond that, and I'm in politics. I can only imagine where my constituents are. They've got to be fed up with it. But I recognize that some of my constituents are like, this is all a hoax. This is baloney. You know, let's just get back to business as usual and the heck with it. And then you've got on the other end people that are scared to death and afraid to go anywhere and think that everyone should be, you know, in a full enclosed container and you know, we should just, you know, lock our doors and stay inside. Most of us are somewhere in between those two extremes. And I think it's important for everyone to recognize that none of us know for sure. We are building this plane while we're flying it. Mm-hmm. But let's be honest about it, and let's look at, you know, what are the numbers, what is going on, you know, with the vaccine. What does it do? What doesn't it do? It doesn't prevent you from getting it. It doesn't prevent you from transmitting it. Apparently, in most cases, it makes you less sick if you've had the vaccine. Mm-hmm. I'll make that statement. And when people watch it, I'll have people complaining that I said that. But I think that's where most of the science is. It's not bulletproof. You know, it doesn't give you permanent immunity, but it's better than a placebo. That's where I am. But I think, you know, the state to say, well, we're going to mandate it, we're going to make your life miserable if you don't get this, we're going to fire healthcare workers that haven't been vaccinated, I think is a bridge too far. You know, you're in a public health crisis. We need all hands on deck. We had everyone working without a vaccine for a year. Now all of a sudden we want to let 30,000 healthcare workers go because we don't need them because they're not vaccinated. I disagree with that. There should have been a testing option there because now we have a healthcare shortage. You know, we have a shortage of providers. We had that shortage before COVID. Now we've only exacerbated it. That was a self-inflicted wound that I think that was done by, I believe, Governor Cuomo on his way out the door. But, you know, Governor Hochul hasn't rescinded that. So, you know, there's things that I think we're not doing well. But I think most people are just trying to find a way to get through this so that we can get our economy going. I mean, the last thing we want to see is school shut down and our kids not getting an education. I've got a kid that's in high school right now, so I'm following the parent set, you know, and how everybody's Johnny and Susie are doing. And no one wants to see the schools close. let's find a way to keep moving forward and keep things open.
It looks like the state's trying to do that with the test kits, working with the counties to get kids tested, and if not forcing them to go home and do remote learning, if they can get the kids tested and keep them in school, that seems to be the goal of most people right about now.
Yep, you know, I mean, early on it was ventilators, right? Oh, we don't have enough ventilators, and then it was PPE. And this seems like ancient history now, but this is a little over, you know, year and a half ago. Then it was vaccines. You know, when the vaccine first rolled out, and I knew it was just a matter of time, let manufacturing spin up, get to capacity, and then we'll have buckets of vaccine. All right, now it's testing. And like I said, I criticized before, we shouldn't have been surprised as a country that we're going to need test kits, because I think that the testing is going to be the best way to slow the spread. With that said, though, in school, you know, talking to the professionals, the healthcare professionals that I have, that is not where the lion's share of the spread is coming from. It's not coming from schools. It's coming from other community events. I think, you know, a lot should be said. We need to protect the most vulnerable. So your older population, the population with comorbidities, other health. If you look at the statistics, and Warren County has done a good job as a county with an email, a daily email that spells out exactly, you know, how many are in the hospital, how many are vaccinated, how many are not vaccinated. You know, and if you see that, some of these trends in these numbers, you know, we've got, you know, it's not being spread in the schools. So let's keep the schools open. But the testing, I think, is going to be a way forward. And again, there will be people that say, the tests aren't foolproof. No, they're not. You know, these instant tests or these antigen tests, you know, if you're really sick, you're going to be positive. Can you get a false negative? Oh, absolutely. And they're not instantaneous. You know, I mean, so there's a lag in some of the testing data. I think it's, you know, I mean, I don't think the do nothing approach is an alternative, but people also should recognize the vaccine isn't 100% effective. The testing has a lag to it and isn't 100% accurate. You know, but you just do nothing and throw your hands up. I don't think most people think that that's responsible either. So just, you know, move forward the best you can, knowing that there's shortcomings in what we're doing. We're building the plane while we're flying it. But with that said, then don't turn around and use any of this as a justification to say, aha, I've got all the answers now. We need to shut this down. We need to shut that down. You know, and again, I think that's where you know, state government has gone a little too far.
The governor's proposing term limits for statewide office holders, including governor. Do you favor that, a two-term limit for governor, lieutenant governor?
Yeah, I think that's reasonable. I suspect that would be strongly supported by the voter. And so the process to make this happen really is it would have to, constitutional amendment would have to pass the legislature twice and then go in front of the voters. So my role here would be, do I think that this should go on the ballot for the voters? Yes. You know, I would support those constitutional amendments, and I suspect that the voters on election day would as well.
Then would you extend it to state lawmakers?
Yeah, you know, if they put that bill in front of me, I would definitely vote yes. I wouldn't vote no. Do I think that the legislature's in a hurry to do that? You know, they haven't historically. I mean, this isn't a new idea. But yeah, no, I mean, now the counter argument to that is every election day is an opportunity to term limit somebody that's in office. There's advantages and disadvantages to having term limits, but I think on the whole, a term limit is not a bad thing. I think it's a good idea.
This past week, the Chamber of Commerce and business leaders here in the North Country called on the legislature to restore funding for a welcome center along the Northway, about 10 miles south of the Champlain border crossing. It's pretty popular with Canadians, about 100,000 stops a year. The info center lets visitors know where they can eat and shop and stay, and it's been closed since the start of the pandemic, and then it lost its funding last year. And they're hopeful that the legislature may restore its funding and maybe even at some point look at upgrading it like some of the welcome centers to the south of Glens Falls and Clifton Park.
Yep. $16 million, that's what the one at exit 17 and 18 on the Northway northbound cost. I got those calls. And we checked when we started getting asked that question. That's what those new upgraded ones cost. They were all in that $15, $16 million range. So put that out there right up front, because there are a lot of people that are like, really, that's a lot of money. But with that said, though,
I think 200,000 they're looking for now.
Yeah,
to get this back up and running.
Yeah, what they're looking for now is very modest by comparison and needed. I mean, it's again, it's the first impression and the first services that a lot of southbound Canadians are going to get coming into to the state of New York. So I mean, when you create infrastructure, you're taking on the legacy costs of maintaining that. So when you make the decision that we're going to put this in the ground, you own it, and you got to be prepared to, hey, after so many years, it's going to need a new roof, it's going to need upgrades, it's going to need, to be renovated. So look, you're either going to make the investment to maintain this infrastructure or you're not. And I don't know how you don't have a welcome center that's presentable and safe and effective, that close to the border. I mean, it's just, you have to do it. And at $200,000, let's find a way. So to me, I think that's an easy one. Well, like I said, if we say, hey, let's talk about upgrading it, we can talk about upgrading it, but everyone should know now you're not talking a couple $100,000 anymore.